Introduction to Addiction Counseling. Addiction counseling is a specialized field dedicated to helping individuals overcome substance use disorders and other addictive behaviors. It involves a holistic approach, addressing not only the physical aspects of addiction, but also the psychological, social, and spiritual dimensions. Counselors work to empower clients, fostering self-awareness and developing coping mechanisms for long-term recovery. The role demands empathy, strong communication skills, and a deep understanding of the complexities of addiction. Effective counseling can significantly improve an individual's quality of life and reduce the societal impact of addiction. This course will provide a foundational understanding of the principles, theories, and practices central to addiction counseling. It will equip students with the knowledge to identify, assess, and intervene in various stages of addiction. Emphasis will be placed on evidence-based practices and ethical considerations, preparing future counselors for the challenges and rewards of this vital profession. Understanding the continuum of care, from initial assessment to long-term aftercare, is crucial for successful outcomes. Understanding addiction, definitions and models. Addiction is a complex condition characterized by compulsive engagement in rewarding stimuli despite adverse consequences. Historically, it was often viewed as a moral failing, but modern understanding recognizes it as a chronic, relapsing brain disease. This disease affects brain circuits involved in reward, motivation, memory, and related control, leading to biological, psychological, social, and spiritual manifestations. It is not merely a habit, but a powerful drive that can hijack an individual's decision-making processes. Recognizing addiction as a disease is fundamental to effective treatment and reducing stigma. Various models attempt to explain the etiology and progression of addiction. The disease model, for instance, posits that addiction is a primary chronic disease of brain reward, motivation, memory, and related circuitry. The biopsychosocial model, on the other hand, integrates biological predispositions, psychological factors like trauma or mental health issues, and social influences such as peer pressure or cultural norms. Understanding these different perspectives is crucial for developing comprehensive and individualized treatment plans. Each model offers valuable insights into the multifaceted nature of addiction. Neurobiology of addiction. Addiction profoundly alters the brain's reward system, primarily involving the neurotransmitter dopamine. When a person uses an addictive substance, dopamine levels surge, creating intense feelings of pleasure. This pleasurable experience reinforces the drug-seeking behavior, making the brain associate the substance with reward. Over time, repeated exposure to the substance causes the brain to adapt, reducing its natural dopamine production and making it less responsive to everyday pleasures. This adaptation leads to tolerance and increased drug use to achieve the same euphoric effect, driving the cycle of addiction. Furthermore, addiction impacts brain regions responsible for executive functions such as decision-making, impulse control, and stress regulation. The prefrontal cortex, vital for these functions, becomes impaired, making it difficult for individuals to resist cravings or consider the long-term consequences of their actions. Chronic drug use also sensitizes stress circuits, leading to heightened anxiety and dysphoria during withdrawal, which further motivates continued substance use. Understanding these neurobiological changes is crucial for developing effective pharmacological and behavioral interventions that target the underlying brain mechanisms of addiction. Psychological theories of addiction. Psychological theories offer valuable insights into the cognitive, emotional, and behavioral factors contributing to addiction. Behavioral theories, such as classical and operant conditioning, explain how environmental cues and consequences reinforce drug-seeking behaviors. For example, associating certain places or people with drug use can trigger cravings. Cognitive theories focus on distorted thought patterns, beliefs, and expectations that perpetuate addiction, such as believing a substance is necessary to cope with stress. These theories highlight the importance of identifying and modifying maladaptive thoughts and behaviors in treatment. Psychodynamic theories explore how unresolved unconscious conflicts, early childhood experiences, and attachment issues can predispose individuals to addiction. Addiction may serve as a maladaptive coping mechanism to deal with underlying emotional pain or trauma. Humanistic theories, on the other hand, emphasize the individual's inherent drive for self-actualization and personal growth, viewing addiction as a barrier to fulfilling one's potential. These perspectives underscore the need for introspection, emotional processing, and fostering a strong therapeutic relationship to facilitate healing and recovery. Understanding these diverse psychological frameworks enriches a counselor's ability to address the root causes of addiction. Sociocultural factors in addiction. Sociocultural factors play a significant role in the development, maintenance, and recovery from addiction. Social influences, such as peer pressure, family dynamics, and community norms, can either promote or deter substance use. For example, living in an environment where substance use is normalized or easily accessible increases vulnerability. Family history of addiction, lack of parental supervision, or family conflict can also contribute to an individual's risk. Understanding these social contexts is vital for comprehensive treatment, as recovery often requires addressing and modifying environmental influences. Cultural factors, including traditions, beliefs, and societal attitudes towards substance use, also impact addiction patterns. Stigma associated with addiction in certain cultures can prevent individuals from seeking help, while others may have cultural practices that involve substance use. Economic disparities, lack of access to education, and systemic discrimination can create chronic stress and limited opportunities, increasing the likelihood of substance use as a coping mechanism. Effective addiction counseling must be culturally sensitive and address the unique social and cultural contexts of each client, promoting culturally appropriate interventions and support systems for sustainable recovery. Assessment and diagnosis of substance use disorders. Accurate assessment and diagnosis are the cornerstones of effective addiction treatment. The process involves gathering comprehensive information about an individual's substance use patterns, history, and related problems. This includes details about the type, quantity, frequency, and duration of substance use, as well as any previous treatment attempts. A thorough assessment also explores an individual's physical and mental health, family history, social support systems, and any co-occurring disorders. The goal is to develop a clear understanding of the client's unique needs and challenges. Diagnosis of substance use disorders, SUDs, typically follows criteria outlined in diagnostic manuals like the DSM-5. This involves evaluating a client against specific symptom clusters related to impaired control, social impairment, risky use, and pharmacological criteria. Counselors utilize structured interviews, standardized screening tools, and collateral information from family members or other professionals, with client consent, to ensure a comprehensive and accurate diagnosis. A precise diagnosis guides the development of an individualized and appropriate treatment plan, ensuring that interventions are tailored to the specific nature and severity of the client's disorder. Screening tools and techniques. Screening tools are essential instruments used to quickly identify individuals who may have a substance use disorder or are at risk. These tools are typically brief, self-administered questionnaires or short interviews designed to flag potential problems, not to provide a definitive diagnosis. Common examples include the AUDIT, Alcohol Use Disorders Identification Test, for alcohol, and the DUST, Drug Abuse Screening Test, for drug use. Their primary purpose is to determine if a more comprehensive assessment is warranted, streamlining the diagnostic process and ensuring timely intervention. Implementing these tools effectively requires proper training and understanding of their limitations. Techniques for administering screening tools vary, often depending on the setting and client population. They can be integrated into routine medical checkups, mental health evaluations, or intake processes in treatment centers. It is crucial to administer these tools in a non-judgmental and confidential manner to encourage honest responses. Counselors must also be prepared to discuss the results with clients, explain the implications, and make appropriate referrals for further assessment or treatment. Effective use of screening tools allows for early detection and intervention, which can significantly improve long-term outcomes for individuals struggling with substance use. DSM-5 criteria for SUDs. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, provides the standardized criteria for diagnosing substance use disorders, SUDs. The DSM-5 combines previous categories of substance abuse and substance dependence into a single disorder, with varying levels of severity. It outlines 11 criteria across 4 main areas: impaired control, social impairment, risky use, and pharmacological criteria, tolerance and withdrawal. A diagnosis requires at least 2 of these criteria to be met within a 12-month period, indicating a problematic pattern of substance use, leading to clinically significant impairment or distress. The severity of an SUD is determined by the number of criteria met. 2 to 3 criteria indicate a mild SUD. 4 to 5 criteria indicate a moderate SUD. 6 or more criteria indicate a severe SUD. Counselors must be proficient in applying these criteria, conducting thorough interviews, and gathering relevant information to make an accurate diagnosis. Understanding the nuances of each criterion, such as persistent desire or unsuccessful efforts to cut down, or continued use despite knowledge of having a persistent or recurrent physical or psychological problem, is crucial for effective clinical practice. This framework ensures consistency in diagnosis and guides appropriate treatment planning. Treatment planning, principles and practice. Treatment planning is a collaborative process between the counselor and client, designed to outline the specific goals and interventions for recovery. It begins with a comprehensive assessment that identifies the client's strengths, needs, problems, and resources. The plan is individualized, recognizing that each person's journey to recovery is unique. Key principles include client-centeredness, cultural sensitivity, and a focus on measurable, achievable goals. A well-constructed treatment plan serves as a roadmap, guiding the therapeutic process and ensuring accountability. Effective treatment plans typically include problem statements, clearly defining the issues to be addressed, long-term goals, representing the ultimate desired outcomes, short-term objectives, specific and measurable steps towards long-term goals, interventions, outlining the strategies and techniques the counselor will use, target dates for completion, providing a timeline for progress. Regular review and revision of the treatment plan are essential to ensure it remains relevant and responsive to the client's evolving needs. This dynamic process allows for adjustments as the client progresses through recovery, ensuring that the plan continues to support their journey effectively. Motivational interviewing in addiction counseling. Motivational interviewing, MI, is a client-centered, directive method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. It is particularly effective in addiction counseling because many individuals struggling with substance use are ambivalent about changing their behaviors. MI operates on 4 core principles: express empathy, develop discrepancy, roll with resistance, support self-efficacy. These principles guide counselors in creating a supportive and non-confrontational environment, fostering a client's own reasons for change. The approach avoids direct persuasion, instead drawing out the client's own arguments for change. MI techniques involve specific communication skills, often summarized by the acronym OARS: open-ended questions, affirmations, reflective listening, summaries. These skills help counselors build rapport, understand the client's perspective, and elicit change talk, statements by the client revealing their desire, ability, reasons, and need to change. By focusing on the client's strengths and autonomy, MI empowers individuals to take ownership of their recovery journey. It is a highly effective approach for engaging clients who are resistant to change, helping them move from contemplation to action in their recovery process. Cognitive behavioral therapy (CBT) for addiction. Cognitive behavioral therapy (CBT) is a widely used and highly effective therapeutic approach for treating substance use disorders. It is based on the premise that thoughts, feelings, and behaviors are interconnected, and that maladaptive thought patterns and behaviors contribute to addiction. CBT helps clients identify and challenge these distorted thoughts, often referred to as cognitive distortions, which can trigger cravings and relapse. By learning to recognize and reframe negative thinking, individuals can develop healthier coping strategies and responses to high-risk situations. CBT techniques in addiction counseling include identifying triggers and high-risk situations, developing coping skills to manage cravings and avoid substance use, practicing refusal skills to decline offers of substances, learning problem-solving techniques to address underlying issues, engaging in behavioral experiments to test new ways of thinking and behaving. Through structured exercises and homework assignments, clients learn to monitor their thoughts and behaviors, gradually replacing destructive patterns with constructive ones. The goal is to equip individuals with practical tools to maintain sobriety and prevent relapse, fostering long-term recovery by changing both their thinking and their actions. Dialectical behavior therapy (DBT) applications. Dialectical behavior therapy (DBT), originally developed for individuals with borderline personality disorder, has proven highly effective in treating substance use disorders, especially when co-occurring with other mental health conditions. DBT emphasizes balancing acceptance and change, helping clients regulate intense emotions, improve interpersonal relationships, and tolerate distress without resorting to substance use. It integrates cognitive behavioral techniques with mindfulness practices, offering a comprehensive approach to managing complex emotional and behavioral challenges. The dialectical aspect refers to the synthesis of opposing ideas, such as accepting oneself, while simultaneously working to change. DBT skills are typically taught in 4 modules: mindfulness, focusing on the present moment without judgment; distress tolerance, learning to cope with painful emotions and situations without making things worse; emotion regulation, understanding and managing intense emotions; interpersonal effectiveness, improving communication and relationship skills. These skills are crucial for individuals in recovery, enabling them to navigate difficult emotions and social situations without relapsing. Counselors trained in DBT provide both individual therapy and group skills training, offering a structured and supportive environment for clients to learn and practice these vital life skills, fostering resilience and long-term sobriety. Group counseling in addiction treatment. Group counseling is a fundamental component of addiction treatment, offering a unique and powerful therapeutic environment. It provides a safe space for individuals to share their experiences, receive support from peers, and learn from others facing similar challenges. The group setting fosters a sense of community and reduces feelings of isolation, which are common among individuals with substance use disorders. Through shared narratives and mutual encouragement, members gain new perspectives and develop a sense of belonging, crucial elements for sustained recovery. The dynamics of the group itself can be therapeutic, mirroring real-world social interactions. Key benefits of group counseling include peer support and validation, reducing feelings of shame and stigma; learning from others' experiences and coping strategies; developing social skills and improving interpersonal relationships; receiving constructive feedback in a supportive environment; practicing new behaviors and communication styles. A skilled group facilitator guides discussions, ensures a safe environment, and manages group dynamics, promoting productive interactions. Group counseling complements individual therapy by addressing social aspects of addiction and providing a practical arena for practicing recovery skills, making it an indispensable part of a comprehensive treatment plan. Family systems and addiction. Addiction is often described as a family disease because it significantly impacts every member of the family system. The family unit can inadvertently enable or perpetuate substance use, or conversely, serve as a powerful source of support for recovery. Addiction can lead to communication breakdowns, eroded trust, financial strain, and emotional distress within the family. Family members may adopt various roles, such as enabler, hero, scapegoat, or lost child, in an attempt to cope with the chaos created by the addiction. Understanding these dynamics is crucial for effective intervention. Family counseling in addiction treatment aims to address these systemic issues, improve communication, and establish healthier boundaries. It helps family members understand addiction as a disease, reduce blame, and learn how to support their loved one's recovery without enabling. Interventions may include psychoeducation about addiction, developing effective communication strategies, and addressing codependency patterns. By healing the family system, counselors can create a more supportive and recovery-conducive environment for the individual with the substance use disorder. Engaging the family in treatment can significantly improve treatment outcomes and long-term sobriety for the client. Pharmacotherapy for substance use disorders. Pharmacotherapy, the use of medications, is an important component of comprehensive addiction treatment, especially for certain substance use disorders. Medications can help manage withdrawal symptoms, reduce cravings, and prevent relapse, thereby supporting an individual's journey to recovery. It is crucial to understand that pharmacotherapy is most effective when combined with behavioral therapies and counseling, as it addresses the biological aspects of addiction, while counseling addresses the psychological and social factors. This integrated approach provides a more holistic and robust treatment strategy. Common medications used in addiction treatment include opioid use disorder, methadone, buprenorphine, naltrexone. These help reduce cravings and block the effects of opioids. Alcohol use disorder, naltrexone, acamprosate, disulfiram. These help reduce cravings, manage withdrawal, and deter drinking. Tobacco use disorder, nicotine replacement therapies, bupropion, varenicline. These help manage nicotine withdrawal and reduce the urge to smoke. These medications are prescribed and monitored by medical professionals, and counselors play a vital role in educating clients about their purpose, benefits, and potential side effects. Collaboration between medical staff and counselors ensures that clients receive integrated and coordinated care, optimizing their chances for successful recovery. Co-occurring disorders, mental health and addiction. Co-occurring disorders, often referred to as dual diagnoses, involve the simultaneous presence of a mental health disorder and a substance use disorder. This is a common presentation in addiction treatment, as mental health conditions like depression, anxiety, trauma, or bipolar disorder can both contribute to and be exacerbated by substance use. Individuals may use substances to self-medicate uncomfortable mental health symptoms, creating a vicious cycle. Conversely, substance use can trigger or worsen underlying mental health issues, making diagnosis and treatment more complex. Recognizing and addressing both disorders concurrently is essential for effective recovery. Integrated treatment is the gold standard for co-occurring disorders, meaning that both the mental health and substance use issues are treated simultaneously by the same team or in a highly coordinated manner. This approach contrasts with sequential treatment, where one disorder is treated before the other, which often leads to poorer outcomes. Counselors must be equipped to screen for common mental health conditions, understand their interplay with addiction, and collaborate with mental health professionals, Providing integrated care ensures that clients receive comprehensive support for all their needs, leading to more stable and sustainable recovery from both conditions. Relapse prevention strategies. Relapse is a common, though not inevitable, part of the recovery process for many individuals with substance use disorders. Relapse prevention strategies are crucial for equipping clients with the skills and foresight to anticipate and manage high-risk situations. These strategies focus on identifying triggers, developing effective coping mechanisms, and building a strong support system. It is important to normalize the concept of relapse as a learning opportunity, rather than a failure, encouraging clients to re-engage with treatment if a slip occurs. Proactive planning is key to long-term sobriety. Key components of relapse prevention include identifying personal triggers, internal and external, developing a personalized coping plan for cravings and high-risk situations, building a strong support network, family, friends, support groups, learning stress management and emotional regulation techniques, creating a balanced lifestyle with healthy activities and routines. Counselors work with clients to create a comprehensive relapse prevention plan, often including emergency contacts and steps to take if a slip happens. This plan is a dynamic document, regularly reviewed and updated as the client progresses in their recovery, providing a robust framework for maintaining sobriety and navigating challenges. Ethical considerations in counseling. Ethical practice is paramount in addiction counseling, guiding professional conduct and ensuring client well-being. Counselors must adhere to strict ethical codes, which typically cover principles such as beneficence, doing good, non-maleficence, doing no harm, autonomy, respecting clients' right to self-determination, justice, fairness, and fidelity, honoring commitments. These principles form the foundation of a trusting therapeutic relationship and protect vulnerable clients. Understanding and consistently applying these ethical guidelines is a continuous responsibility for every addiction counselor, ensuring high standards of care. Key ethical considerations include confidentiality, protecting client information with specific limits to confidentiality, e.g., harm to self or others. Informed consent, ensuring clients understand the treatment process, risks, and benefits before agreeing to services. Boundaries, maintaining professional boundaries to avoid dual relationships or conflicts of interest. Competence, practicing within one's scope of expertise and seeking supervision or consultation when needed. Cultural competence, providing services that are sensitive and responsive to the client's cultural background. Navigating complex ethical dilemmas requires careful thought, consultation with supervisors or colleagues, and adherence to professional codes. Ethical practice safeguards both the client and the counselor, upholding the integrity of the profession and promoting effective, responsible care. Legal aspects of addiction treatment. Addiction treatment is governed by a complex web of legal regulations designed to protect client rights, ensure quality of care, and maintain confidentiality. Counselors must be knowledgeable about federal and state laws that impact their practice. Key federal regulations include 42 CFR Part 2, which specifically protects the confidentiality of substance use disorder patient records, imposing stricter rules than HIPAA in many cases. Understanding these laws is critical for avoiding legal repercussions and upholding professional standards. Compliance with legal requirements is not optional, but a mandatory aspect of ethical practice. Other important legal considerations include mandated reporting, obligations to report child abuse, elder abuse, or threats of harm to self or others. Duty to warn, the responsibility to warn potential victims if a client expresses a serious threat of violence. Licensure and certification, adhering to state-specific requirements for practicing as an addiction counselor. Documentation, maintaining accurate and thorough client records, which can be subject to legal review. Counselors must stay updated on evolving legal landscapes and seek legal consultation when faced with ambiguous situations. Adherence to these legal frameworks ensures that treatment is provided within a lawful and responsible context, protecting both the client and the practitioner from potential legal challenges and ethical breaches. Cultural competence in addiction counseling. Cultural competence is the ability of counselors to understand, appreciate, and effectively interact with people from cultures and belief systems different from their own. In addiction counseling, this means recognizing how cultural background influences an individual's perception of addiction, their help-seeking behaviors, and their preferred treatment approaches. A culturally competent counselor acknowledges and respects the client's cultural identity, values, and traditions, integrating them into the treatment process. This approach moves beyond mere awareness to active engagement and adaptation of services, ensuring that interventions are relevant and respectful. Developing cultural competence involves self-awareness, understanding one's own cultural biases and assumptions, knowledge, learning about diverse cultural groups and their experiences with addiction, skills, adapting counseling techniques and communication styles to be culturally appropriate, advocacy, working to address systemic barriers and promote equitable access to care for all cultural groups. Failure to provide culturally competent care can lead to misdiagnosis, ineffective treatment, and client disengagement. By embracing cultural competence, counselors can build stronger therapeutic alliances, improve treatment outcomes, and ensure that all clients receive respectful and effective care tailored to their unique cultural contexts, fostering trust and promoting healing. Special populations, adolescents and older adults. Addiction counseling requires specialized approaches for different age groups, particularly adolescents and older adults, due to their unique developmental, psychological, and social needs. Adolescents are particularly vulnerable to substance use due to their developing brains, peer influence, and identity formation challenges. Treatment for adolescents often involves family engagement, school-based interventions, and addressing co-occurring mental health issues. The focus is on early intervention, education, and developing healthy coping skills to prevent long-term problems. Understanding the specific risk factors and protective factors for this age group is paramount. Older adults also represent a special population, often facing unique challenges such as age-related health issues, social isolation, grief, and polypharmacy, use of multiple medications. Substance use in older adults may be overlooked or misdiagnosed as other age-related conditions. Treatment approaches must be sensitive to their physical limitations, cognitive changes, and social support needs. Interventions may include integrated medical and behavioral health care, support groups tailored for seniors, and addressing underlying issues like loneliness or chronic pain. Tailoring interventions to the specific needs of these populations ensures more effective and compassionate care, leading to better outcomes for both adolescents and older adults. Trauma-informed care in addiction. Trauma-informed care is an approach that recognizes the widespread impact of trauma and understands potential paths for recovery, integrating this knowledge into all aspects of service delivery. Many individuals with substance use disorders have a history of trauma, which can significantly contribute to the development and maintenance of their addiction. Substances may be used as a way to cope with the overwhelming emotional pain, flashbacks, or hyperarousal associated with past traumatic experiences. A trauma-informed approach shifts the focus from what's wrong with you to what happened to you, promoting healing and reducing re-traumatization. Key principles of trauma-informed care include safety, ensuring physical and psychological safety for clients, trustworthiness and transparency, building trust through clear communication and consistent boundaries, peer support, utilizing individuals with lived experience to foster hope and connection, collaboration and mutuality, sharing power and decision-making with clients, empowerment, voice and choice, supporting clients in regaining control over their lives. Cultural, historical, and gender issues, recognizing and addressing the impact of these factors. Counselors apply these principles by creating a safe and supportive environment, avoiding triggers, and empowering clients to participate actively in their treatment. This approach helps clients process trauma in a safe manner, develop healthy coping mechanisms, and ultimately achieve sustainable recovery from both trauma and addiction. Recovery-oriented systems of care. Recovery-oriented systems of care, ROSC, represent a paradigm shift in addiction treatment, moving from an acute care model to a long-term chronic care management approach. ROSC emphasizes that recovery is a continuous process, not a single event, and that individuals can and do recover. These systems are person-centered, holistic, and built upon the strengths and resilience of individuals, families, and communities. They aim to provide a comprehensive network of services and supports that are accessible, coordinated, and sustained over time, adapting to the evolving needs of individuals in recovery. The focus is on supporting individuals in achieving and maintaining long-term recovery. Key components of ROSC include continuum of care, a seamless array of services from prevention to long-term recovery support. Peer-based recovery support, services delivered by individuals with lived experience of recovery. Community integration, supporting individuals in becoming active and contributing members of their communities. Family involvement, engaging families as essential partners in the recovery process. Measurement of outcomes, continuously evaluating the effectiveness of services and systems. Counselors operating within a ROSC framework collaborate with various providers, advocate for client needs, and connect individuals to a wide range of recovery support services. This comprehensive approach recognizes that recovery is a journey that extends beyond formal treatment, requiring ongoing support and community engagement to foster lasting change and improved quality of life. Aftercare and continuum of care. Aftercare refers to the ongoing support and services provided to individuals after completing primary addiction treatment, such as residential or intensive outpatient programs. It is a critical component of the continuum of care, designed to help clients maintain sobriety, prevent relapse, and successfully reintegrate into their communities. Aftercare plans are highly individualized and may include a variety of services, recognizing that recovery is a lifelong journey. The transition from structured treatment to independent living can be challenging, making robust aftercare essential for sustained success. Elements of effective aftercare often include regular participation in support groups, for example AA, NA, continued individual or group counseling, sober living environments or halfway houses, vocational training and employment support, educational opportunities, family counseling and support, case management services to coordinate care. Counselors play a vital role in developing comprehensive aftercare plans with clients, connecting them to appropriate resources, and monitoring their progress. By providing ongoing support and addressing emerging challenges, aftercare significantly enhances the likelihood of long-term recovery and improved quality of life, ensuring that individuals have the necessary tools and support to thrive beyond initial treatment. Professional development for counselors. Professional development is an ongoing and essential aspect of an addiction counselor's career, ensuring that practitioners remain competent, effective, and up-to-date with the latest research and best practices. The field of addiction treatment is constantly evolving, with new therapeutic modalities, pharmacological interventions, and understanding of neurobiology emerging regularly. Continuous learning helps counselors refine their skills, expand their knowledge base, and adapt to the diverse and complex needs of their clients. It is a commitment to lifelong learning and excellence in practice. Key areas of professional development include continuing education units, CEUs, to maintain licensure and certification, specialized training in new therapeutic approaches, for example, trauma therapies, specific CBT techniques, supervision and consultation with experienced colleagues, attending conferences, workshops, and seminars, engaging in self-care practices to prevent burnout and maintain well-being, Counselors are encouraged to seek out opportunities for growth, both formally and informally, to enhance their clinical skills and ethical decision-making. Investing in professional development not only benefits the individual counselor, but also elevates the quality of care provided to clients, contributing to the overall advancement of the addiction counseling profession. Future trends in addiction treatment. The field of addiction treatment is continually evolving, driven by advances in neuroscience, technology, and a deeper understanding of human behavior. Future trends are likely to include increased integration of technology, such as telehealth services, mobile apps for recovery support, and virtual reality for therapy and skill building. These innovations can expand access to care, personalize interventions, and provide real-time support, particularly for underserved populations. Embracing technological advancements will be crucial for modernizing treatment delivery and improving client engagement. Other emerging trends involve a greater emphasis on personalized medicine, tailoring treatment based on an individual's genetic profile, neurobiological markers, and specific psychosocial needs. There will also be continued growth in harm reduction strategies, focusing on minimizing the negative consequences of substance use rather than solely on abstinence. Furthermore, the integration of holistic approaches, including mindfulness, yoga, and nutrition, is expected to become more widespread. Counselors must stay abreast of these developments, adapting their practices to incorporate evidence-based innovations and ensure that clients receive the most effective and cutting-edge care available, shaping the future of addiction recovery.